Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me introduce myself. My name is Andri Bimantara. You can call me Andri. In this video, I will explain a topic about hallucination, which is a part of course pediatric mental health nursing, with Nurse Nehru Nugroho anchor as the lecturer. In this video, I will discuss several topics including the definition of hallucination, focus data of hallucination, type of hallucination, the goals of the nursing care, and the strategies for the patient and families in managing hallucination. Alright, let's start with the first topic. First topic is definition of hallucination. What is hallucination? Hallucination is a sensory perception disorder in which a person experiences a perception even though there is no real external stimulus. In simple words, a person might hear, see, smell, taste, or feel something even though the stimulus is not actually present. Hallucination can involve several senses, including hearing, vision, smell, taste, and touch. Now that we understand the definition of hallucination, let's move on to focus data that can be found in patients with hallucination. The focus data can be divided in two categories: subjective data and objective data. Subjective data comes from what the patient feels, experience, and tell us directly. For example, the patient might say that they hear voices and whisper that other people cannot hear. The patient might also say that they see shadow or something that is not actually there. In addition, the patient may report the hallucination appear at the certain time or in certain situation. The patient might also feel afraid, anxious, or disturbed when the hallucination appear. Number 2 is objective data. Meanwhile, objective data from what the nurse observed directly. For example, the patient may appear to talk or laugh the timeless. The patient might stare or look in the certain direction. The patient might cover their ear as if they are listening to something. The patient might also appear restless or frightened without any clear external stimulus. So, in simple terms, subjective data comes from the patient on the statement, while objective data comes from the nurse observation. After understanding the focus data, let's continue with the different type of hallucination. There are 5 main types of hallucination based on the sense that is a fake. Number 1 is the first is auditory hallucination. In this type, the patient hears voice, whisper, or conversation that are not actually present. The second is visual hallucination. The patient might see shadows, shapes, people, or objects that are not actually there. The third is olfactory hallucination. The patient smells a curtain, odor, even though there is no real source to smell. The fourth is gustatory hallucination. The patient exercises a certain taste in their mouth, even though there is no actual stimulus causing it. And the last is tactile hallucination. The patient might feel sensation on their body, such as being touched, scratches, beating, or feeling something crawly in their skin, even though there is no actual stimulus. So, these 5 types of hallucination are classified according to which sensory system is affected. After understanding the type of hallucination, we also need to understand the goals of nursing care. Goals of nursing care. The main goal of the nursing care for patients with hallucination is to help patients recognize and control their hallucination. Patients are also expected to be able to distinguish between real stimuli and hallucination experience. In addition, patients are expected to show more appropriate sensory perception and response. So, the goals of nursing care is not only to reduce hallucination, but also to help patients recognize, control, and respond to hallucination in more adaptive way. To achieve this goal, there are several strategies that can be provided to patients. There are four main strategies or SP for patients with hallucination. SP1. The focus is on recognizing hallucination and controlling them by recognizing the hallucination. The goal is for the patient to be able to recognize hallucination and control them by using the reprimanding technique. The intervention include number one, building a trusting relationship with the patient, identifying the type, content, time, frequency, situation, and response to the hallucination. Explaining how to control hallucinations by using the reprimanding technique. Training the patient to reprimand the hallucination. And the last, encouraging the patient to include the reprimanding exercise in their daily activity schedule. Example statement, the patient can practice saying, "Go away, I don't want to hear that voice, I don't want to see it, I will not follow the voice." So, in SP1, the patient is first to recognize their hallucination and then trying to use the reprimanding technique when the hallucination appears. Next is SP2, which focus on controlling hallucination through regular medication. The goal is for the patient to be able to control hallucination by taking medication regularly. Intervention they include number one is evaluating the patient's ability to use the reprimanding technique, explaining the benefit of taking medication regularly, explaining the type, the doses, schedule, method of administration, and benefits of medication according to the treatment program, explaining the importance of taking medication as prescribed, and the last, training the patient to follow their medication schedule. Example statement, the patient can say, "Medications help me control my hallucination. I have to take my medication regularly as prescribed." So, in SP2, the patient is helped to understand the medication address is an important part of controlling hallucination. The next strategy is SP3, which focus on controlling hallucination by talking with other people. The goal is for the patient to be able to control hallucination by talking with other people. The intervention includes evaluating the patient's ability to use the reprimanding technique and take medication, explaining the benefit of talking with others to distract the patient from hallucination, training the patient to invite other people to talk when hallucination appear, according the patient not to isolate themselves when hallucination appear, encouraging the patient to include talking activities in their daily schedule. Example statement, patient can say, "When the voice appears, I will find a friend or a nurse to talk to." By talking with other people, the patient can shift their attention away from the hallucination and avoid focusing too much on the experience. And the last strategy for the patient is SP4, which focus on controlling hallucination through scheduled activities. The goal is for the patient to be able to control hallucination by performing activities according to schedule. The intervention include number one is evaluating the patient's ability to use the reprimanding technique, take medication, and talk with others. Identifying activities that the patient likes and is able to perform, training the patient to perform activities regularly, carrying the daily activities scheduled together with the patient, and the last, encouraging the patient to follow scheduled activities. As an example statement, the patient can say, I will do the activities on my schedule so I don't spend too much time daydreaming and my hallucination can be controlled. Just as before, patients are expected to have structured activities so that exercise, free time, and isolation can be reduced. Besides the patient, the family also the important role in managing. And the last topic is there are also 4 strategies that can be provided to families. Number 1 is SP1. In SP1, for the family, the focus is on helping the family understand the hallucination problem experienced by the patient. The intervention include number 1, explaining the definition of hallucination. Number 2, discussing the problems experienced by the patient. Number 3, increasing family support for the patient. So, in this first stage, the family requires an understanding of the patient condition so they can provide appropriate support. Next is SP2 for the family, which focus on helping the family care for patients with hallucination. The intervention include number 1 is taking the family how to communicate with the patient. Number 2, not confirming or reinforcing the hallucination. Number 3 is the not arguing with the patient. Number 4, technique reality orientation. And the last, encouraging the patient to participate in the positive activities. Therefore, the family needs to respond calmly and supportively without confirming the patient hallucination or arguing about the patient is the experience. And the next, we can move to SP3 for the family, which focus on the supporting medication. The intervention includes monitoring the medication schedule, supporting the patient to attend regularly checkups, monitoring possible medication side effects, evaluating the patient's medication adherence. With family support, patients are expected to be more consistent in following their treatment program. And finally, SP4 for the family, focus on preventing relapse. The intervention includes recognizing the signs of relapse, maintain good communication with the patient, creating the calm and comfortable environment, accompanying the patient in activities, of taking the patient to healthcare facilities using clinical support. From the family strategies, the family can become an important source of the support, help treatment, and recognize early signs of relapse. So, from everything we have discussed, we can understand that hallucination or perception is something that requires for appropriate care to support. The management of hallucination does not only focus on the patient, but also recommend the involvement of the family. Through strategies such as reprimanding hallucination, taking medication regularly, talking with others, and doing scheduled activities, patients can learn to control their hallucination. Meanwhile, families can provide support by helping with the medication adherence, maintaining maintaining good communication, creating comfortable environment, and the recognized signs of relapse. The recovery process might take time. However, every small important is still an important step forward. Therefore, let us provide care with patience, empathy, and without judgment. Recovery is a journey, not a race. Every step of care can bring hope, feeling, new possibilities. That is the end of my explanation about hallucination. Thank you very much for watching this video. Wassalamualaikum warahmatullahi wabarakatuh.